Hey there, this is Dr. Pam Perry. Thanks for joining us today for another Speakers Magazine show and an Amazon Live and a YouTube Live as well. And of course, LinkedIn. You know, I love you. So, we're talking today with Dr. Angela Marshall, who was featured in our May issue of Speakers Magazine. There she is right there. Dr. Angela Marshall is our guest today. She's been featured in Speakers Magazine. You can go to speakersmagazine.com and read about her there and also the video. But I'll give you a little bit about her. She's a published author. This is her new book, brand spanking new book. So let me read you a little bit about her before I bring her up. So Angela Marshall, MD, FACP, is the founder of Comprehensive Women's Health, a primary care practice for women in 2 locations in Washington, D.C. area. She is a board-certified internist and a fellow of the American College of Physicians. She is an expert on all forms of bias in healthcare and how they affect both individuals and our society at large. Throughout her medical career, Dr. Marshall has impacted the lives of thousands of women by promoting a style of medical practice that emphasizes patient-centered, empathetic listening. She has been repeatedly named top doctor by the Washingtonian magazine and is a recipient of the 2020 Maryland Top 100 Women Award, 2015 Enterprising Women Award of the Year, and also Bravo Magazine's Smart CEO Bravo Magazine Award and the Circle of Excellence Award. So she's got a lot of awards. She was just at an event this past week and she probably won some awards there at WPO. A contributing health expert. She's been featured on CNN, Fox News, PBS, NewsHour, and OWN. And Dr. Marshall currently chairs the board of directors for the Black Women's Health Imperative and is a staunch advocate for achieving health equity for medically vulnerable populations. She is found online at Angela Marshall MD, but you don't have to wait for her to be online. She is right here. There she is. Oh, good. So I gave that long introduction, but I really wanted people to know about the book Dismiss and tackling biases that undermine our health care. And you and Kathy did this book together, and it is a Citadel Press, which is a division of Penguin Random House, which is a division of Kensington, uh, all the things, but is a major published book. So I wanted to just say congratulations on that. That is no easy feat because you're a busy doctor with 2 locations, right? Two centers, and you also did this book, and you've been practicing medicine for a while, but I want people to know your backstory, Dr. Marshall, because it's very interesting. It's not the typical way where people go to college and then they go to medical school. So kind of tell them a little bit about your background because I find it so interesting, and tell us the why you did it that way too.
Yeah. Well, first of all, thank you for having me, Dr. Pam. I'm so happy to be here and, just to be on the same platform with you is great. So thank you.
Thank you.
Yeah. So, interestingly, I think, and I just realized this recently, is that I think part of what inspired me to go into medicine in the very beginning was as a child, I actually grew up without health insurance.
Hmm.
And the first time I was dismissed was when I was 8 years old. We didn't have health insurance, and my mom scraped together the few dollars that she needed to take me to the doctor because I was having headaches.
Mm-hmm.
And when she put her little money together, took me to this doctor, he looked at me and he looked at my mom and he said, "There's nothing wrong with her." And so, interestingly, and of course, as someone, who's, struggling to get by, the first thing you think is, why did I spend all this money on, you, and there's nothing wrong with you, this and that. Well, I found out later, it wasn't until I went to medical school that I learned that I suffer from migraine headaches. And so
Oh,
that's not something that typically you see objective findings in,
mm-hmm.
and so part of, my interest in medicine stemmed from just not having access to health insurance and just being very curious about my own health and wanting to make sure that people like me had access to health care. And so, as you mentioned, I didn't take the direct path that most people take,
Mm-hmm.
a lot of that was for financial reasons, and also because I was a first generation college student. So I
Okay.
was the first in my family to go to a 4-year college. I had a grandmother who had a 2-year nursing degree, but I was the first one to go to a four-year college. And so, it was new, and the thought of going from living under the federal poverty line
Mm-hmm.
to med school, that was a big jump. That my mind couldn't even fathom that at that
Right.
time.
Because it's not just this 4 years plus another 4 years plus, yeah,
Yeah,
and
not to mention how are you going to pay for that?
right,
And
right.
so it was just such a daunting, you know, it was just a daunting thought even. And so what I did know also is that in addition to being interested in medicine, I was also interested. I love math and I love science. And so, engineering, I had a family member who was in engineering, a family friend.
Mm-hmm.
And so I said, you know what? Maybe I'll do engineering. And if I, decide to go on to medical school, I can still do that. But at least if I stop at the 4-year degree, I'll have a nice, way of
Career.
living and be
Yeah.
able to, yeah, do well as an engineer. So that's what I did. I probably
And
did
and,
it the
and, and
most.
this I'm gonna stop you right there because the things that you did, it's just like, oh, okay, well, I like math, so I'm gonna go be an engineer. I mean, you could have majored in anything, like, not that any of them are easy, but you know what I'm saying? It's just like,
Yeah,
okay, it's not a lot of women in engineering.
right.
Okay, so you were way ahead, like, we call it the STEM, right? The science, technology, engineering, and math, right? So
Yeah,
it's like this is a thing that it's like, okay, well, this is it because you realize that if I went to college, that if I don't get into medical, because first of all, 4 years is enough. And then it's like for another four, it's like, oh my God, how am I going to pay for that? It's like, well, you had enough, really like a wit about yourself to say, okay, even if I don't, I'm going to at least do this. I know that I'm good at it, and I'll be able to make a career. And
yeah.
then in the back of your mind, you always said, I really want to be a medical doctor. I really want to go into the healthcare, but engineering and healthcare are totally different. So go on, continue.
They are. And so, it turned out that I took the path of most resistance, to get to medicine because I chose electrical engineering. And the reason why I chose that is because I really wanted to do biomedical. But
Okay.
at the time at Georgia Tech, which is where I attended, they didn't have a biomedical degree back then. They just had electrical. And so if you were interested in biomedical, you would major in electrical and just take a few classes in biomedical. What turns out now, Georgia Tech has the number one biomedical engineering major in the country. Um, but so I majored in electrical engineering. And then as soon as I changed my major to engineering, I got all these scholarship opportunities. And so I took a scholarship with the government who paid for my entire undergraduate education. It was a
Oh
great
my God.
scholarship named after the late Congressman Lewis Stokes, who was
Oh
a
yeah.
big
Oh, Louis
champion for equal opportunity and
from
education.
Ohio. Mhm.
from Ohio. And
Yeah.
oh my gosh, that scholarship was like winning the lottery, you
Oh
know.
my God.
It
That is so I want
yeah,
to just stop right there. That is really so, and I'm going to share this with Chuck Stokes, which is his son, who is a friend of mine, and he's a reporter here at the ABC affiliate here in Michigan.
you
And
know,
his spot it's like the legacy of things that African American don't know sometimes the impact that they have, but I know that Louis Stokes was a very, very just proactive education. His son, same thing. He's a public affairs reporter, host. Chuck Stokes is, and so that is just really just a side note of just how things just kind of line up for you. Because you were saying when you were in school earlier, I heard from another interview that you were on food stamps and that kind of thing, and that you lunch lines and all of that. So it wasn't like single parent home. It wasn't like, okay, we had all this money and you're gonna go to college. We're gonna pray for you to go to medical school, and we don't know how we're gonna pay for it. But you were like, well, I'm gonna switch over to engineering, and then all of a sudden the scholarships just poured in and paid for 4 years of your undergrad. Okay, all right.
yes.
So that
And
is so
and I'm so grateful. I would love to, talk to his son, or get word to his
yeah.
son,
You will.
because I when several years after I left that agency, I sent Congressman Stokes a nice thank you letter,
Oh,
letting him know how grateful I was, just absolutely grateful
oh,
for that scholarship. And I'm assuming he got it,
yeah.
because and then he passed away, several years later.
Mhm, mhm.
But just such an impactful thing to have in my life, and to be able to have that opportunity. It was just, and one of the things I shared was that even though I didn't stay at that agency, I was, going back to medical school and committed to helping our people, and, being a productive member of society. So it was just a wonderful opportunity.
That is good. Hey, Mark Perry says we're talking about a smart woman. That is for sure, for sure. Thank you, Mark. So one of the things too that so making the pivot, okay, getting into medical school is not easy, right? Because sometimes some people go that 5th year gap and they've got to do this pre-med classes. So you went from being an engineer, studying for the MCAT, passing it, and then tell us about at that point what happened.
Well, so, and one of the things that made me, because I was set to be an engineer, because by that time I had forgotten that, my original plan was to go to medical school, because I was pretty focused on being an engineer. I was working for a great, organization, but I realized I was doing a lot of volunteer work outside of work. After
Okay.
hours, I was volunteering in the community, working with the youth at risk program, and doing all this volunteering. And then I learned something about myself. I learned that I really needed to feel like I was helping people every day. Like I needed to feel like I was making a
Mhm,
difference every
mhm,
day. And then
mhm.
that's when I said, had I gone to medical school,
You would
I
be
would
doing that.
have it in my day job,
Yeah, yeah,
so,
exactly.
yeah. So
That's the part of your purpose that was just like just calling you and pulling you in. It's like, okay, you're calling, you're smart, you know the math, the engineering. It's like, but then when your volunteer hours kind of like are balancing like 40 hours of volunteer and 40 hours of work.
yeah, exactly.
Like, I think I need to really probably do this as my day job of helping people. So that's
Yes.
the clue. That is just
Yes. And yeah, and so then I, took the MCAT. And, interestingly, when I applied to medical school, I was a very unconventional student, because I was a little older, a couple of years older than the rest of the applicants. And I had this different background of engineering, and I worked for one of the three-letter government organizations. And so I definitely stood out
and
as an
you were married.
applicant. What's
And you
that?
were married.
And I was married at the
Yeah.
time, yes.
So
So
then
it
your husband had to buy into this going back to medical school because you're not really working a full-time job when you're in medical school.
That's right. Yes. And so, yeah, at the time, yeah, we had a, little talk, and
I had
so
to
that we
sacrifice.
just made it happen. Yeah.
Yeah, you had to make a sacrifice at that point in time. And
Yes.
so you are an internist, and then within that, it's such a the book is not about your background, but you do weave the background, but your background is so inspiring because what you did, you really are a shining light to what other people can do as well. But the heart of what this book is about really talks about the biases that undermine our healthcare. So give us the story that really when you were quote unquote dismissed, and talk about your son that
Yeah.
yeah.
And so, throughout, once I, was able to get a job and health insurance and everything, I had lots of good examples of, experiences in healthcare. But during my second year of medical school, I had my first son, and he, was fine. He had a little congenital abnormality, but he did fine. And so when we planned for our second child, we were concerned about that congenital abnormality, but when we did our research and when we talked to specialists, they said, hey, that was a fluke. That usually doesn't happen again. And so you should be good to go. So we had my second son. Lo and behold, he had the same birth defect, which they detected in utero this time, but it was a much more severe case than what my first son had. And
Mhm.
so we knew that he was going to have some challenges. And so when he was born, he was, in the hospital for about 2 months. But he got discharged. He was making progress. I had taken time off to take care of him. I had taken off like 7 months. And so he was doing well. And we
You were
were,
in medical school during that time, Doctor?
I had just finished all of my rotations except
Okay.
for one.
Yes.
And so I
Okay.
had 1 month left. I had tried to finish all of them, but they put me on bed rest that last month. So I had to save that last month to the very end.
Mhm.
But what happened is after he was born, he was discharged after 2 months, making progress. And so he had kidney failure as a
Mhm.
result of this birth defect. And so we were waiting for a transplant. And so trying to get them big enough because they like to do transplant after they're about 6 months old and they have to be a certain weight. And so on one fateful day, he had an appointment at the doctor's office, the specialist's office, which happened to be inside the hospital because this was a kidney specialist.
Okay.
And so when I got him up, I noticed his eyes were crossing, like one would be this way and the other one straight, like they
Mhm.
weren't coordinated in their movement. And he
Mhm.
was breathing really fast.
Mm.
And so I knew something was wrong. So thankfully he had an appointment that morning. So I, hurried, got him up got him together and called ahead to tell the doctors that, hey, something's wrong. We're on our way, but hey, something's really wrong.
Mhm.
And so, be ready. And so when I got him there, here I'm on 10, like
Right.
something's wrong. The eyes are, and I immediately felt like the doctor didn't get his level of concern didn't match mine at
Yeah.
all. Like he
Yeah.
just totally blew me off.
Dismissed. Right.
And so I said, well, okay. So then he left the room. And so then I called him back. And then he left the room again. And then I called him back. So the last time I called him back, the nurse came. And the nurse said to me, she says, yeah, I I agree with you, because he at that point they had done his vitals. He was breathing 100 times a minute. A
Ooh.
normal pediatric breathing rate is about 40. Okay,
Okay.
so he's breathing 100 times a minute. And in peds, the breath rate is that's like a very important vital sign when kids are in distress. And I knew that because I had already done, most of my medical school.
Mm.
And so at that point, I called him back and then I got more, more assertive, more aggressive, like, hey, something's wrong here. When are you going to treat my son? And so at this point, they had decided to admit him to the hospital, but they
Okay.
were waiting on a bed.
Oh my God.
And and so then finally, he realized I was, very, very alarmed, frustrated, and concerned. And so then finally, I guess he thought he'd reassure me. So he says, well, look, I understand your frustration, but I see this all the time. I've been doing this for 30 years, and he's going to be fine. We're going to get him admitted. We'll get him tanked up with fluids, get his electrolytes back in balance, and he'll be back to himself in no time. And so after that, I said, okay. And then I even felt bad because I was like, well,
Am
maybe
I hysterical? Am,
I'm
am I a hysterical mom? Or
I'm
yeah,
being hysterical, and I said, okay. And so then
with your doctor. So it's like,
yeah, I hadn't graduated yet,
but you study,
but
right? Yes.
when we have those moments where people make you question your intuition, you know what I mean? All it takes is somebody look at you like, what are you talking about? Or that's not right.
Mhm,
Or
mhm.
no, and so it was that. And that's the biggest regret I have, is that I let him tell me, something different from what I knew in my spirit. I knew that he was in trouble.
Mhm.
And so after he reassured me, I said, well, okay. And then I thought, well, he does have 30 plus years of experience. And so then he walked out of the room and left me and the nurse. And within about a minute, my son coded with me and the nurse in the room. He stopped
Mhm.
breathing.
Oh my God.
And in the moment, the nurse looks at me. She said, you're going to have to do CPR. We're going to have to do CPR. And so we both did CPR in the time that it took for the code team to arrive back to the room. And then they, swiftly kicked me out.
Mhm.
But my son didn't make it.
Mhm.
And I really felt like it was because they didn't act in time.
Mm.
They didn't. And the worst
They
thing
they
about it,
dismissed you. They
they
dismissed what you were
dismissed
saying.
me, they dismissed him. And the worst thing about when those kinds of things happen is, it's one thing when things happen and somebody just doesn't make it, and you grieve and all that. But when you knew that that's where things were headed, and you tried to tell them that when you knew that something was right and you tried to tell them, that is a whole nother level of
Mhm.
um, it's a whole nother experience that no one should have to go through. And
Ex
so I had that 1 month left of medical school.
That probably changed the whole trajectory of everything that you felt about medicine and the healthcare industry, because if it can happen to you, it happens to others probably often. Probably happens for infants that can't say anything, or people who are caregivers for seniors, and the seniors or have dementia and they can't really say, and then they're just, so
Yeah.
it's it, or even if you're just going to the doctor yourself, you have to be the advocate for yourself. It's like, listen, my hands are swelling, my feet are swelling. I want to know what's going on. Oh, well,
Yeah.
couple months, we'll send you to a specialist when there's room,
Yeah.
or anything like that. Yeah.
Right. And the thing about that whole healthcare doctor patient relationship, the power dynamic is, important, because the doctor has all the power, right? And so when you're a patient, it's hard to it's hard to you know
To override what they have to say.
override, right? All
Yeah.
you can do is ask.
Yeah.
All you
And
can
if
do is tell them and ask and hope that they hear you.
Mhm, mhm.
And so that was, the worst day of my life.
Yeah.
It literally has taken me over 20 years to be able to talk about it
Mhm. Thank
publicly.
you for sharing. Thank you.
I
Thank
wrote
you
this book
for sharing.
recently, but I couldn't even speak about it. I had to go to therapy, that
Mhm.
it was a big, life blow, to say the least. And so,
But
uh,
that was the thing that really made it so poignant of why you speak about this now across the country. You speak on it often. You're sharing it on platforms because it is an issue that most people go through. They don't know how to even articulate it. But you being, helping thousands of women, through your medical practice, going through medical, both sides. And so it makes it really important for people to hear you and to hear how it is that they can really be their own advocate and how they can really solve the problem. I mean, the book helps open up the discussion, and then you have different things that when you speak about how to really solve this problem. And tell us some of the places where I believe it was the Black Women's Health Initiative, or just different places where you speak about this issue and you find that it resonates with people.
Well, yeah. So interestingly, since I wrote the book, and since I've spoken about this, there, every time I speak about this book and this topic, someone comes up to me afterwards and says,
Mhm.
I had this experience, or my family member, or So it's so unfortunately, it's so common, and the sad part is that sometimes people don't know that they're missing, certain treatments based on who they are. And so when this happened to me, the first thing you ask is why, right?
Mhm.
Why did this happen to me? As a
Mhm.
Black woman, one of the first things I think is because I'm Black.
Mhm.
And so when I wrote this book, one of the things that I thought about doing is writing this from a medical justice racial perspective for Black folk, because there's a lot of medical mistrust in our community, and it's there for a reason, because
Mhm.
we have just not been treated well historically.
In the
And
United States,
we've
that's
got
true. Mhm.
so many examples of us getting subpar inferior care.
Mhm.
And but one thing I realized is that it's not just Black people.
It could be
Um,
elderly,
you
right?
know, Women sometimes don't get they get dismissed when they complain of heart symptoms, because our symptoms tend to be different from men. And
Mm.
so a lot of times doctors dismiss women as having anxiety when they're really having a heart attack, right?
Wow.
Um, I've heard so many stories from patients, patients with obesity who struggle with their weight, who've
Mhm.
told me things like, "Oh, you're the first doctor who looked at me as a person, and you're the first doctor who took me seriously. Every other doctor has blamed everything wrong with me on my weight."
Mm. Mhm.
There are other factors where seniors sometimes don't get
Right.
adequate, people don't see them as,
Mhm.
you know, aged adults.
Mhm.
They see them as, you know, having less value, you
Right.
know.
Right.
And so I think some of this comes from uh, a lack of respect or lack of value for folks in certain demographic groups, or people who don't look like the doctor who's treating. And so that's where, I really want to raise the awareness, not only in patients, but also in healthcare providers,
Yes.
knowing that, guess what? We're all human. And this book is not meant to indict doctors. It's meant to help doctors and nurses and all healthcare providers to be aware of the natural bias that comes to mind when you're engaging in human interactions.
And then also too, one of the things that you talked about earlier was that the healthcare system just needs an overhaul, because it is so many patients and people are overworked. And there's just people who are in studying public health, or people who are in medical school, or, it's a book for the medical student to have, the doctor to have, the nurse to have, the patient to have, so they can look at it holistically and see what are the missing pieces. What is it, besides the doctor really being empathetic and listening? What else is there? I mean, so you can't, if you have, I don't know, 15, 20 patients a day, you can't spend 3 hours with everybody. Right.
Yeah,
Like,
And not only that, it also just the administrative burdens that have
yeah,
been
oh
put
my God.
upon doctors.
Woo!
It's almost like,
It's like
operate.
hazing.
Yeah,
It reminds me of hazing because I have some friends that are doctors and they were telling me about the paperwork. I said, it feels like you're being hazed. I was like, what is this all about? Can someone make that simpler?
yes,
Someone can think this through. I mean, we have all kind of systems, all kind of technology. Can we make it simpler for the paperwork, the bureaucracy, that the insurances? I mean, all of those things are really burdening the healthcare system. So then it's like we don't have the time for the patients because we're dealing with all this paperwork. So that part right there is discussed as well. It's like someone,
exactly.
please, it needs to be more of an open discussion about
Yes,
all of those things because no one wants to have the tragedy of someone really being dismissed because of all the things that you talk about in the book. And so there's solutions, but it's almost like you can't really solve anything until we recognize there's a problem. So step one is like just admit or recognize that there is a problem, and then we can go on to the solutions. Then we can have more discussions. Then we can actually solve some of the problems. And it may not be in our lifetime, it may not be in our generation, but at least if medical students and things like that have this book, they can see the holes, like what
yes,
needs to be fixed. And that's
yes,
really the key. I want people to really make sure that they take that they go to your website. I meant to put it up earlier, angelamarshallmd.com. Definitely make sure that you can click and get the book on Amazon. It's roughly right now 30% off, about 27% off. So you can click it and get on Amazon Live and get the book. It is in hardcover. Soft cover is coming, ebook is coming, audiobook is coming, but right now get the book in hardcover and then go to Angela Marshall MD and stay connected with Dr. Angela. She's available for speaking. Obviously, that's one of the main things that she does, and this is her passion. This is her passion. I mean, obviously, medicine is her passion, but really talking about the healthcare and really the biases and tackling that and really taking on that big subject. I mean, it's from a personal standpoint, very, very personal, all the way up to this now is really, I call it like is his mission. The mission is bigger
yes,
than you. The
yes,
mission is bigger than you. So I just thank you so much for sharing your story. Like I said, you're so inspiring just from where you came to, from the engineer to the med school, all of those things, the non-traditional, but um, it's something that I know that this is a legacy book, like a legacy book for many medical professionals, in the future. I actually, there's a couple of people I know that their kids are majoring in public health. This is like a whole big thing now, public health. And so
yes,
I said, you need to get this book. And I was telling them about you, and they were like so excited. It was like, oh my God, can I speak with her? I was like,
yes.
yes, you can. You go to Angela Marshall MD, send her email. She's gonna be very, very busy with this book, speaking and things like that. I said, but maybe you can catch her at one of the events where she's going to be speaking.
Yes.
So is there anything that you like to, last words before we kind of close out this interview, and what you would like to tell people, in mostly um, in terms of their career choices overall, or just in terms of the medical things that they're encountering?
Yeah, I think so. I attended a business conference last week, and one of the things that they talked about is the importance of hiring slow and firing fast. And I
Mm,
think we have to do the same thing when we're selecting our doctors. We
mm,
need to take our time and hire our doctors slowly, get to know them, ask them questions, interview several doctors before you settle on someone. And if someone's not giving you what you need, if someone's not listening to your concerns, and it's certainly if someone's not believing your concerns, then it's definitely time to fire that doctor and move on.
That is so true. That is so true because one of the things is what you just said, really kind of from instinct. Sometimes if you kind of have that instinct, like, I don't know, it's something that I can't explain it, but there's something there. And if it's something there, then just kind of move on.
Yeah,
Don't dismiss your hunches, don't dismiss your intuition, don't dismiss if you believe in God, the Holy Spirit trying to tell you to go a different way. And it's okay
the
because you just
discernment.
Yes,
Yeah.
we just have to find another one. So I want people to know they can go to Speakers Magazine, read about you, and then your videos and things like that will be there as well. I think the owned clip is in this embedded in the digital version as well and on the website, so they can actually go there as well. But thank you so much, Dr. Marshall, for joining us today. Speakers Magazine show. We'll be seeing more and more of you. People can actually book you to speak. Dr. Angela Marshall, MD, as well. So thank you so much for joining us today.
Thank you so much for having me. This is a great platform. Thank you. And thanks
Thank
for all that you do.
Oh, thank you. Thank you. So, with that, I am Pam Perry, and we are out today. Thank you so much for joining us today, and we will talk with you later. Alrighty. God bless. Bye bye.
Wow.